Building Consensus for EHR by Patti, McClelland, Karen Miller, Deborah, Nary, Loree Parker. This is our outline for building consensus. We're going to talk about increasing quality of care and financial stewardship and the considerations involved. EHR is an electronic record of a patient's health. It is created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. There are benefits to an EHR. The EHR automates and streamlines the clinician's workflow. It gives us evidence-based decisions and quality management and outcomes reporting. It provides secure, immediate, patient-centered information for clinicians when they need it. There's benefits to an EHR that you can see everything on a patient's chart all at the touch of a button. Difference between EHR and EMR. The EMR is based only in one facility. It's a building block of the EHR. It takes a lot of little EMRs to make one big EHR system. The EHR increases quality of care by decreasing documentation errors, omissions of pertinent patient information, and integrating other modalities from the health system. The EHR will adopt standard clinical terminology to be used to decrease documentation errors, systems like SNOMED. Healthcare staff will no longer have to decipher clinicians' handwriting orders. There will be less errors because of it. Prompts will ensure nursing provides correct documentation and administration of medications and treatments. The prompts will also remind staff to chart pertinent information. There will be required fields or mandatory fields where you can't leave the flow sheet or the documentation until you document something like an allergy. It won't allow you to file the information. There will be improved data integrity, which will make information more readable, organized, and accurate. And the EHR will bring together information from all healthcare facilities that the patient has been to allow for faster and better medical care. The EHR will draw information from EMRs around the country. Patients will use a patient health record system to access their own laboratory results that the doctor releases to them, medication lists and appointments, but they won't be able to view things like doctor's notes that are still private. Continuity of care will be assured by the CCD when the clients move between various points of care. A snapshot or summary of the care one provider gave will be available to the next provider. It will help improve reimbursement rates from places like JCO, CMS, and QF. If you comply with the regulatory agencies and reduce your safety hazards that create adverse events or sentinel events in your hospital, or what they call never events, you will reduce punitive fines and improve your reimbursement rates. So remember, prevent never events to improve reimbursement. There will be improved efficiency with billing. You'll have electronic submission of claims. There will be billing codes straight from the EHR. There will be electronic tracking of payments, less paperwork, and there will be supplies on the EHR that will be maintained by somebody in a very important database. We will lower employment costs by using the EHR. And this report by Bauer and Kumar in 2011 says that there is a cost savings primarily attributable to automating numerous time-consuming, paper-driven, and labor-intensive tasks, which allow for reduced staffing and resource requirements. So these are the considerations when implementing the EHR. Meaningful use priorities. What is meaningful use? Meaningful use is defined by the use of certified EHR technology in a meaningful manner, which ensures that the certified EHR technology is connected in a manner that provides for electronic exchange of health information to improve quality of care of the patient. When you use the certified EHR technology, the provider must submit to the Secretary of Health and Human Services information on quality of care and other measures, and this in the long run helps to improve care in the healthcare system. Priorities of meaningful use are to reach the following outcomes: improving quality, safety, efficiency, engaging patients and family in their health, improving care coordination, improving health of the population and public, ensuring adequate privacy and security protection for personal health information, increase health information exchange, and provide secure online access to health information for patients. So meaningful use is an incentive program, basically. This is what it means to you. It's an incentive program to receive financial incentives when you successfully implement your certified EHR technology. And Medicare and Medicaid incentive programs are phased into 3 categories, with each stage requiring increasing participation from hospitals and professionals. Cost of implementing the EHR varies greatly from facility to facility due to size, amount of full-time providers, and pre-existing technology. The 5 main components of EHR to consider when you're estimating costs: hardware, EHR software, implementation assistance, training, and ongoing network fees and maintenance. Incentives. The incentives of the EHR, the financial costs of implementing EHR can be offset by offering incentives once providers show meaningful use in EHRs by meeting required objectives. These requirements vary based on facility type. And this is a chart that shows Medicare and Medicaid payments over time in the 3 stages, and that there is a maximum amount of payments. While there's a max on payments, there isn't one on losses, so you want to reduce your losses as much as possible. There's staff resistance versus acceptance, one of the concerns. So change is worrisome, people don't like it, clinicians are all pressed for time in a stressful environment, so you have to streamline the work and just make it easy for them to learn. And in the beginning, it's not going to be streamlined, it's going to feel stressful, but you have to let them know that it will get better. Older physicians are a problem because of their age, and the financial investment required to set up the EMR systems are also a problem. So they're basically letting the next generation deal with the computers and simply just dealing with their paper charts. So issues at hand. The research shows that the minority of physicians that do use the EHR, the majority of them are satisfied with it, and they have positive effects on their patients and practices. It's a slow and difficult process to implementing the EHR, but experts believe that a national medical record database would be useful. And the problem is that there is lack of standardization and regulation from government officials and agencies. So planning is the key, and you just get the right people involved, and remember to always speak to the individual of what is expected of each person. Involve the need for electronic health records in your vision statement, and just make it easy for them to access with password problems. You don't want to have anything like that. And involve the key staff who can have the employees buy into the system and take ownership of the project. EHRs versus paper system, and regardless of how familiar you are with your paper system, EHRs can improve quality and convenience of patient care, increase participation in care, improve accuracy of diagnosis and health treatments, and increase efficiency of practice and cost savings. Disaster recovery is easier with the EHR. You can back up everything to the internet into the cloud and prevent information from being destroyed by natural disaster or sabotage. You can access information anywhere, anytime, and that's a good thing, and reduce storage of paper. In conclusion, EHR systems have the potential to improve communication, and physicians and healthcare organizations can successfully alter implementation process of the new HR systems to make this transition safer and more efficient. And if they do that, the enhancements they offer to healthcare practitioners will be likely realized more rapidly. Thank you.